The West Nile virus is a member of the genus Flavivirus and the family Flaviviridae. West Nile virus is a member of the arbovirus group, which means it's arthropod-borne, so it's carried by insects such as mosquitoes and ticks and things like that. Arboviruses of this Flavivirus genus, they have the ability to infect vertebrate and invertebrate hosts, so it has a variety. It is also very closely related to the viruses that cause dengue fever and yellow fever. And right here, I found a microscopic picture or view of the West Nile virus. The West Nile virus is gram-stain negative. Its cell wall is very thin, so it doesn't hold that purple stain. It ends up being not basically like pinkish in a slide. It is single-stranded, so it has a lot shorter chains of nucleotides than other cells. It is non-motile. It does not have the ability to create ATP, and ATP is what makes things move. So it needs the host system to pick up and move it. It's spherical shaped, and this shape is optimal for forming that closed shell that has the capsid underneath it, and inside the capsid is the DNA or the RNA genetic information. It is a positive sense RNA cell, which means it has positive polarity. It's very, very similar to mRNA, messenger RNA, and so it can be immediately translated in the host cell, and then it rapidly replicates and moves through the body very quickly. It is enveloped. It's made up of that lipid membrane that encloses the genetic material, that capsid, and the envelope forms when it is leaving the host cell. One of the unique features that makes the West Nile virus hard to fight is the ability it has to cross the blood-brain barrier. When it's in the host system, it sets off the receptors in the immune cells that activate immune response. And when they respond, the blood-brain barrier has a tendency to weaken a bit, and the virus then takes the opportunity to jump in there and enter the nervous system, the central nervous system, and starts to do damage. Its reservoir. First of all, the vector for the West Nile virus is arthropods, like mosquitoes and ticks, but it is mostly the mosquitoes. The mosquitoes bite the infected bird, which is the reservoir for the virus. And for the most part, birds are the main host. The virus has been detected in 250 different species of dead or dying birds. In the US, it's mainly the crow family that is the most susceptible and affected by the West Nile virus. Horses and we as humans are considered dead-end hosts and not reservoirs for the virus, which means that we can be bitten and it can be given to us, but we don't actually transmit it to other people.
Hi, so I'm going to give you a rundown of the transmission of West Nile virus. So the main transmitter is mosquito bites, as I'm sure a lot of people know. But there are also a couple of uncommon transmitters. These are very uncommon, very rare, but they do occasionally happen, so they're worth mentioning. One is blood transfusions, organ transplants, lab setting exposure, and then from mother to baby. It can be transferred either during the pregnancy, during the delivery, or through breastfeeding. And then some things that are not transmitters, even though people might think that they are. So casual human-to-human contact or human-to-animal contact, because sometimes animals can be infected. So handling live or dead birds, as I'll tell you in a second, birds are where it comes from. So Handling live or dead birds cannot transmit the disease. And then also consuming the infected birds or other animals is not a way to transfer the disease. So those are things not to worry about. So this is just a graphic that kind of shows how West Nile virus is spread. So there's the mosquitoes and the birds. The mosquitoes bite the birds, get the infection, and then they can then go and bite humans or other animals and spread the infection, spread the virus. And so it's just a good graphic to kind of give you a visual on it. So I'm going to go through the signs and symptoms. So first of all, there are essentially 3 different levels, or I would call them degrees of infection. So the majority of people, 70 to 80% of people, have no signs, no symptoms, and don't even know they have it. And then about 10% of people will have mild infection with mild signs and symptoms, and then less than 1%, so a very, very rare few people will have severe signs and symptoms of the virus. And so I'm going to talk about the mild infection first. So first of all, the first symptoms will show up about 3 to 14 days after being bitten. And some signs of the mild infection would be diarrhea, rash, vomiting, swollen lymph glands, and fever. And then some symptoms that they might have would include headaches, body aches, joint pain, fatigue, weakness, eye pain, back pain. These are very, very similar to just the flu. So a lot of people might not even realize that they have West Nile virus because it feels very similar to the flu. So the fatigue and the weakness can last for a few weeks. However, people will completely recover from the mild infection. However, the severe infection can cause neurological problems such as encephalitis, which is swelling of the brain, and then meningitis, which is swelling of the membranes around the brain and the spinal cord. So those are really serious problems. Some signs of those would be really high fever, stupor, coma even, tremors, muscle jerking, convulsions. There's partial paralysis, sudden muscle weakness, disorientation, confusion, lack of coordination, vision loss, and numbness. So pretty serious signs. Some symptoms that they might be feeling are severe headache, neck stiffness, and then just general pain. Similar to the mild infection, they would have like back pain, joint pain, body aches, things like that, but really severe. And then those headaches are really, really bad. So because they have swelling in their brain. So that's a big problem. And then, so this is really rare, but 10% of those people that have the severe infection will die from it. And also the effects can be permanent. So there's paralysis that can be permanent, and then brain damage from the swelling of the brain. So those are really serious things. So treatment of West Nile virus. So mild infection, really all you can do is just take over-the-counter medication. Painkillers to treat the headaches, the body aches, things like that. There's no specific medication or anything to treat West Nile virus. You just have to treat the symptoms. And so with the severe infection, since you're just treating the symptoms, a lot of them will have to get into the hospital so they can have nursing care, so they can receive IVs, so they can get prescription strength medication to kill the pain, and just anything they can do to kind of ease and feel better through the virus while it's running its course. So prevention and control. So vaccine does not exist. There's no vaccine for it. However, there are some things you can do to prevent getting it. The biggest, of course, would be avoid mosquitoes. So mosquitoes are most active around dawn and dusk. So keep that in mind, and then wear, insect repellent, use mosquito nets, screens on your windows and doors at your house, and then avoid standing water. That would be like ponds, lakes, things like that. And then also there's standing water, if there's any standing water in your in your yard, like in your flower pots or something. Remove the standing water so that the mosquitoes aren't attracted. And then wear long pants and sleeves. And then another thing to keep in mind is if you see any dead birds, you might want to alert the local authorities so they can keep an eye on, the West Nile virus and see if there's any breakouts. And then these are some sources that I use to get all my information. And I'm going to have my husband talk to you guys a little bit. So he actually was one of the people who had the rare severe infection. And so he's going to explain a little bit about his experience. And so I'll put him on and he can tell you about what he went through.
My name is Craig Tanner. I've been asked to share my story about West Nile virus. I was diagnosed with West Nile virus about 8 years ago, but I was diagnosed about 8 years ago, but the symptoms started about 9 years ago, in 2006, which was right in the middle of the really bad, West Nile virus outbreak that was happening here in the United States. So 9 years ago, I got what, a lot of you would consider as just really bad flu, body aches, vomiting, those sort of things. However, when that went away, I was left with a really bad headache. I now know that as the early symptoms or the early stages of encephalitis, which is inflammation of the tissue around the brain. But at the time, we didn't know that. And, as this headache lasted for a week or two, I went and saw just a normal physician, just a family practice doctor, and they just thought it was really bad headache and gave me some painkillers and sent me home. But it just didn't go away. In fact, it kept getting worse and worse. In fact, it got so bad that I started losing my vision. At one point, I had even lost my vision completely. So I remember waking up and just everything was dark. I don't know why that had happened. I still kind of don't. But my vision was just so blurry and so terrible. I was getting, dizzy all the time, so I was falling over as I just walked down the street, which was really frustrating. And then, I stopped eating almost completely. So I lost about 50 pounds. And so I was down to about 120, 125. And, I was at this was also really trying on me both physically, but also emotionally and spiritually, for sure. So, it was hard. I was at peak condition in my life. I was very healthy. I was running marathons at this time in my life. I was, 19, 20 years old. And so, I felt I was very healthy, and all of a sudden West Nile hits, and, my body is destroyed, and I'm practically bedridden. So it was very hard. By the time I got diagnosed, or when I got diagnosed, they admitted me into University of Utah Hospital, as outpatient. I was there for about 4 months. So I'd drive there, or my parents would drive me there every single day to get treatment for different things. For the headaches, they just kept me on, high doses of painkillers. For the inflammation and the encephalitis, we had to go through a series of spinal taps to remove the pressure around the brain. This also helped a lot with the vision and the dizziness as well because there was less pressure there. So that improved as we would do all these spinal taps. But those definitely aren't fun things to go through. Um, I had to change around my diet quite a bit. So, I had to stop eating red meat and any dairy products, and I still don't, just because I couldn't. And I also had to get an IV about 3 to 4 times a week, both for nutrients, but also for um, like immune boosters. My immune system was just, practically destroyed at this point. So I was on high doses of vitamin C and magnesium. So, those first 2, 3 years were really scary. I was, at the risk of dying. At some point, doctors even told my parents that they didn't think I would make it because I'd lost so much weight. And that's really, really hard to see your parents go through and to live through. But since then, after kind of, this decline and then my turnaround point from when my body started reacting and really fighting it off, every year's been better, and now I live, a practically full and normal life. I get, symptoms every now and again when I get sick with something else. I'll notice some West Nile symptoms. But other than that, I'm doing pretty well. So that's my story.
So lastly, we have a little bit of a history and some interesting information on the West Nile virus. We thank you for watching our video and enjoy our Fight the Bite picture. Thank you.